Hello everyone. Today back on to the South is at ITC, the Immunity Therapy Center, and I'm very glad to be here with Dr. Carlos Bautista, who is going to talk about hyperthermia therapy. Dr. Bautista, thank you so much for having us. How are you today?
Hi, good afternoon. Very well. Everything well, thank you.
Excellent, excellent. And can you please tell us what is the hyperthermia therapy and how does it work?
Gladly, yes. Well, hyperthermia is a therapy that has been around for a while. There's been a lot of research done and consists on increasing either body temperature to around 104 Fahrenheit, that will be about 40 centigrades, either whole body or locally to the cancer or tumor area. This is with the intention of destroying cancer cells. Cancer cells do not tolerate temperatures above 104 Fahrenheit. So this is used as a cancer treatment alone, or it can be used with many different other treatments combined.
And what types of hypothermia therapy are available and how do they differ?
Well, we have two types mainly. We have the whole body hyperthermia and we have the local hyperthermia. These are sophisticated devices that are used with different penetration and different intensity. The whole body hyperthermia, it's a chamber that you will have different, you monitor the patient for temperature, heartbeat, blood pressure. The intention is to create a fever, 104 Fahrenheit, 40 centigrade more or less. And the other type is local, where you use different hyperthermia devices with different penetrations, where the idea is to reach the tumor area and heat locally the tumor to the same temperature, around 104 Fahrenheit. That will be the target temperature.
Okay, great. And well, of course, there are benefits. So what are the potential benefits of the hypothermia therapy and also for cancer treatment?
Well, the main benefit that you're going to have is tumor reduction, okay? So definitely it's going to help us in reducing the tumor load. Also with inflammation. As a secondary benefit that you will get from this treatment, it's an immune system stimulation. Like when you have a fever and your body, when you have an infection, your body reacts like with a fever. The fever or the body increases body temperature to try to destroy bacteria. It's a situation where we try to reach that temperature because we know that that's going to destroy cancer cells.
Okay, got it. And well, of course, there's the other part. And what are the risks or side effects associated with the hypothermia therapy?
Obviously, you need to do it in a professional setting where they know how to do this treatment. Obviously, you don't want to do it for too long, or you don't want to do it for too short, time. Side effects could be dehydration. Your heartbeat will raise. Your blood pressure will decrease. So you need to be extremely careful controlling all these different parameters to avoid any complication.
Yeah, okay. Got it. And how the hypothermia therapy is typically administered and what's the duration of the treatment?
Well, the whole body hyperthermia, normally it will have a duration of approximately 60 to 90 minutes. Obviously, you're going to reach the temperature and maintain the temperature for around 45, 60 minutes. Okay. The local hyperthermia treatment, depending on the device that you use, there's far infrared, there is more sophisticated devices where they're going to have better penetration. Usually the amount of time that we need is around 30 to 45 minutes, depending on the location and the type of tumor that we're treating.
Okay. And what types of cancer are most commonly treated with the hypothermia therapy, and how successful is the treatment?
Yeah, well, normally it's used in solid tumors, and Normally use in solid tumors, but you can use it in any kind of cancer, okay? Obviously, again, making sure that you don't want to, having everything under control environment. How success is very successful, using it alone or in combination with other treatments as well, okay? So usually we do it in our protocol, we do it in combination with other treatments.
Okay, because that's what I was going to ask you, that hyperthermia therapy can also be combined with other
Absolutely.
cancer treatments?
Yeah, other cancer treatments, we use it with the treatment that we call DPT or low-dose chemo treatment, or we can be used also with radiation treatment. Actually, the effectivity of local hyperthermia in combination with radiation is good. And we do it also in combination with other alternative treatments that we have available as well. Well, yes, there's patients that are in a very critical condition that are not a candidate for this treatment. Patients that have a very abnormal liver function. Obviously, you need to evaluate over the overall condition of the patient. And obviously, again, the main risk is low blood pressure or dehydration or increasing heartbeat. So depending on each patient, that's how we are going to go ahead or not.
To evaluate it, of course, right? Okay, and how does hyperthermia therapy compare to other alternative cancer treatments?
Well, here it's not like you compare to other, because it's a very treatment that works in a very specific way. So what you want to do is to combine with other alternative treatments like we do here, biomagnetic treatment, RIVE, bioresonance therapy, immunotherapies. So this therapy works because we are able to combine with many other treatments as well.
Okay. So that's key, probably. Okay,
that's very important.
Okay, doctor, and what ongoing research is being done to improve the effectiveness and safety of the hyperthermia therapy?
There is research going on here with different types of cancer, with different durations and different intensity of hyperthermia, or in combination with other treatments. There's a lot of publications and there's a lot of research going on all over the world, actually.
Well, that's great. Thank you so much for sharing that with us. And I don't know if there's something else that you would like to add?
Well, here we are specialists in all types of hyperthermia treatments. We have 20 plus years experience doing this in cancer patients, and it's a very safe treatment, effective, and works really well.
Excellent. Well, Dr. Carlos Bautista, what can I say? I think you have the best top treatments here at ITC, and thank you so much for this interview.
Thank you.